Hi everyone, and welcome to Module 12, Health Policy and Advocacy at Torrens University. We're really excited today to present a panel discussion on a day in the life of a public health professional, which is, something that I think you're all aspiring to. We really think this is a great time in your course to be talking about this, so you can start to prepare yourself as you think about future careers. The way you think about future careers will probably change over the time that you are doing your masters. So we want to really show you a few different pathways and a few different options from some experts in the field, people who are out there working and have all had really diverse journeys. Public health is one of those things where not everyone takes the exact same pathway. So hopefully today we can demonstrate that. So I'm going to just quickly introduce our panel members today. We've got Lisa Atwell, who is from Wellbeing SA, which is a bit of a wing off the Department of Health in South Australia. Is that right? Yeah. And I'm sure you'll explain more about that when we get to hear from you. We've got Rachel Ambakshir from Torrens University, who is both a lecturer and a researcher at Torrens University in the area of public health. We've got Victoria Saint from Bielefeld University in Germany, who is a researcher and works within the research department and also a PhD student over in Germany. We've also got Terry Lamery from Torrens University, who is our success coach and also has a lot of experience in a previous career in public health. And then we've got Peter Graves, who is our social enterprise hub manager at Torrens University. You may well have already crossed paths with Terry and Peter and Rachel, but Peter is working on really linking public health and industry from the university side and the industry side. So thank you everyone for joining. I'd like to just ask a couple of people to really tell us your journey in the life of a public health professional. So Rachel, could you start, please?
Yes, thanks, Claire. Well, I think I'm a very good example of a typical public health professional in the sense that it's anything but typical, the pathway that public health people take. It's got tends to have lots of detours and ins and outs and various bits and pieces. So we'll talk a little bit about that, I guess. I actually have been working in the field of health for nearly 30 years now. What's interesting is that I collected 3 degrees during that time, and none of them really had health in the title, except for my most recent PhD in health. So as a Bachelor of Arts student back at the University of Adelaide, my first job coming out of undergrad was actually working for local council as an environmental health project officer. So right from the very beginning, even though I majored in geography, I had an interest in health. And my first job out of uni was actually I was recommended by one of my lecturers to go and work in local government on a health related project. I came back and did my honours, but while I was doing honours, I worked on the Social Health Atlas of Young South Australians with John Glover, who many of you will know works in the Public Health Information Development Unit now in Torrens on level 1. So one of my first real jobs as a graduate was to work on mapping health indicators for one of the first ever social health atlases, which was hard copy then and is now all online. So that kind of led me to a bit of a love affair with maps and with social determinants of health and with health planning as well. So again, as a graduate, that was kind of through my networks. So once you start working, I find particularly in Adelaide, but also a lot of other places, once you start working and you do a pretty good job and you turn up on time and you show an interest in that kind of thing, you often get recommended for other projects because people are looking for people who, I guess who have a passion for health and who apply themselves to the job. Anyway, fast forward a little bit and I ended up working for a uni. So my love affair with health planning and with geography led me to work in SA government for about 8 years. working as a health planner. And in that role, I actually got to drive around all around the northern suburbs to the various community health centres, which were out at Modbury, which were out at Elizabeth, which were out at Salisbury and Enfield. So my job involved a lot of driving, where I basically would go out to the heads of the community centres and talk to them about their populations, like who were they looking to target with their health services. So maybe it was a non-English speaking particular population like refugees or newly arrived. And I'd talk to them about what services they had, and we'd look and see at the match or mismatch between what they were offering and what was needed in their local community. So what have we had so far? We've had local government, we've had university, and we've had state government. And I think I've only covered about 10 years, but I'm going to skip forward. So a few years later, I went to work for a not-for-profit called the Improvement Foundation, once again working with maths and health service planning. And this time we were working with doctors to try and improve the quality of their data, like their health databases and their medical databases. And again, health geography came into it because we were looking to help the Medicare locals at the time, so large, big regional organisations to better plan services in conjunction with the doctors who are working in their areas. So so interesting. So each job was building on the next. So each time I was building expertise and experience and making my name in this particular branch of health service planning that related to geography. But because I was working with GPs in that most recent job, I landed in the end in my job at Torrens. I saw a role advertised as a research fellow, working with Justin Bilby, who was the Vice Chancellor at the time, but also a GP. And he'd just been successful winning a big grant as part of a team to work on frailty screening in general practice. So my years of experience leading up to that drew me into that role. And there we are, like nearly 6 years later and a PhD later. And now I'm working at Torrens as a learning facilitator, course coordinator, and a research fellow. So there you go. I would never have expected, probably in the beginning when I was a geographer, that this is where I would end up. But yeah.
That's great. Thank you, Rachel.
Yeah.
That's brilliant. And it's really good just to see the building blocks. Do you know what I mean? And a couple of other degrees in there and those sorts of things. So it is about lifelong learning. It is about continuing to build on your skills, and you're not necessarily going to know where you're going to be at the beginning. You know, not like, I think probably many careers you're not, but certainly in public health, it's not a linear sort of pathway. So thanks for sharing that. We'll move on to Lisa now. Thanks, Lisa.
Claire. And yeah, I think there's lots of similarities in terms of that journey of sort of trying things and working out what you enjoy, and therefore sort of pursuing that into other roles. So for me, I started out by studying a human movement degree and then a nutrition and dietetics degree. So sort of the healthy eating and physical activity side of things. And so the nutrition and dietetics degree then drew me to working for 6 years in Port Pirie. I guess the first kind of lesson for me was about applying. I had been living in Adelaide, and there were lots of regional opportunities with dietetics, but also many other positions. And so for me, I guess a learning was that to sort of step out of my comfort zone a little bit, move to a regional area because there were lots of opportunities, particularly in health promotion. So I worked in Port Pirie and across that region, like I said, for about 6 years in a role that was a mix of clinical dietetics, but it was really the health promotion part of that role that I really enjoyed. And it was also, I guess, my first taste of what I would now consider as sort of more traditional public health, because of the link between elevated blood lead levels in Port Pirie and healthy eating. So it was a really nice opportunity to work with the community on that as a really specific sort of topic, I guess, that only impacted that community. But working with all different groups within the community in terms of schools and sports clubs and non-government organisations. So following that, I moved back to Adelaide and worked for about 6 years on a project called OPAL, which was a community-based obesity prevention initiative that Terry also knows quite well. And so at that time, it built up to being about 20 sites across South Australia. And yeah, maybe as students you have heard about that initiative, but essentially it was a community-based initiative focusing on healthy eating and physical activity. That was based in a local government in the city of Playford. So again, in a similar way, moved from a health organisation to a council, and just the difference and learning for me about the way that council understood its role in health and wellbeing, and the opportunity for me to be able to explore that more with council about their role and how they could really play and did play, but maybe they didn't fully understand the role that they were playing in terms of the wellbeing of their community. I guess that led me to get really interested in councils and the role that they could play, and was also the time that councils were starting to be required to develop their regional public health plans, so to do their own planning about the wellbeing of their communities. And so led me to move back into state government in terms of SA Health, in terms of a role of supporting councils to first of all develop and then implement their regional public health plans. That was part of an updated Public Health Act. And so spent a bit of time working with councils, and then spent 12 months or so developing the second state public health plan. So that was a massive learning for me. It was the first time I'd developed any kind of a large strategic plan. Lots of consultation, lots of engagement with a range of different stakeholders. And so a whole new set of skills around writing strategies and consulting with community, as well as a range of different organisations. And I suppose that then led me to the path of really knowing that I was enjoying the strategy development side of things around public health planning, the sort of, yeah, the planning aspects. And so in between, I did a bit of uni tutoring and that sort of thing, but essentially then moved through into a role in Wellbeing SA, which I'm currently in, around strategy development. So writing the strategy for our new agency, Wellbeing SA, and setting up all of the structures for that agency. And as you said, Claire, we're an attached office. So we are under the Minister for Health and Wellbeing, but not under SA Health as such. So separate government agency. We're 2 years into operation as part of an election commitment of the Minister for Health and Wellbeing to have a renewed focus on prevention and reinvestment in prevention. So essentially have our strategic directions based around that in terms of chronic disease prevention, focus on the early years, and also mental health and wellbeing.
Oh, thank you. Yeah, that's great. Look, and what's your actual title there? I haven't got that here, so I thought I'd let you say it. What's the actual title?
Yeah, title is Manager, Strategy and Reporting.
Oh, great. That's really good for our students to hear as well. And look, I think really, really interesting to sort of flow through those government jobs and to be there for that duration, and to end up where you are now is incredibly valuable in terms of what's going to come out those policies, or hopefully from that prevention side. And I think South Australia is doing reasonably well in that area, but obviously time always tells, doesn't it, what actually gets spat out in policies. But that's just a really good and just slightly different story to Rachel, and also just that interesting idea of going out to rural areas to get an opportunity, and certainly something that we recommend to our students that they may have to do. They might have to relocate to do that, and sometimes in Australia that is those rural areas where there's a specific health issue. So thank you for sharing that. That's great. All right, let's move on to Victoria in Germany, and you'll hear from her accent. She's actually Australian origin and is living in Germany at the moment, but I'll let you introduce yourself.
Thanks, Claire. So my name is Victoria Saint. I am currently coming to you from Berlin, where it's about 5 degrees, but I'm originally from Adelaide, and I did a double Bachelor Health Science, Social Science at Adelaide University, majoring in psychology and public health. And I used that as a kind of buffet to decide what I wanted to do. I had a few different directions, but just kind of fell in love with public health and the intersection of health and political and personal and individual and family issues that public health enables you to kind of tackle and engage with. And I then went and did my Master of International Health in Sweden at an institute that specialises on maternal and child health. And I did my thesis looking at some work being done in Rajasthan in North India related to health equity and social determinants of health. And that really cemented my passion for kind of social justice issues within the health sector. And I've spent more or less the last 10 years living in Europe and working in a kind of variety of different roles and jobs, but in particular working as a consultant and then a staff member with the World Health Organization headquarters in Geneva in the social determinants of health team, and working as a consultant, an international consultant on a variety of policy and kind of policy translation, evidence translation issues related to health equity and social determinants. And in particular, my portfolio focused on looking at how the health sector itself needs to kind of reorient itself to better address equity, how you do that within a specific health program or within a specific ministry or within a specific strategy, both within the World Health Organization, so how we were supporting other teams to be more equity oriented, and then also how we supported ministries and governments and government and non-government agencies in a variety of different countries, high, middle and low income countries. So that was a messy pathway. And I think maybe one of my, rather than going into the detail of that, perhaps the more, the overarching kind of message I would say is you don't always know. I mean, I think it's when we have these types of panels, I think there's quite often the idea, it sounds like everyone had this clear idea of what they were doing and present them in a very linear career way. And for me, I just kind of took opportunities that looked really interesting, and I randomly end up in places for personal reasons or out of curiosity. Interesting opportunities landed in my lap and I kind of derailed myself for 3 months to pursue them. So I think that kind of seizing the opportunities and creating opportunities for yourself would maybe be one of the key kind of messages that comes out of my CV. I moved to Berlin 6 years ago. My husband is German and we were sick of doing long distance. So I moved for personal reasons. And for the last 2.5 years, I've been working at Bielefeld University, which is has a special school of public health. And I work in a team that looks at population health and health services research. And I'm leading the expansion of internationalization and global health within the Master of Public Health program, and hence I'm collaborating with Claire and doing these types of initiatives to kind of build institutional partnerships. And I also we do a range of research, and my PhD in particular focuses on looking at the equity issues within antimicrobial resistance and the way in which the global policy and global strategies are not addressing gender equity and social determinants of health issues. Claire, I think I'll stop there and we can move into some questions.
Yeah, no, that's great. And just brings that global perspective. And again, that sort of taking opportunities, being ready for whatever comes your way and being passionate. And if you're passionate and, you know, you can follow your career, sometimes a personal situation does mean that something lands on your lap and you need to be ready and open for that. And I think that people that do study public health are not necessarily looking for an easy fix. They're looking to kind of make a difference in the world. And we certainly believe that we do to some small degree, but it is about social justice and being part of the sort of global community. So thanks for bringing that perspective in too. All right, so we'll just segue, ask Terry to just quickly, first of all, talk about the experiences you've had in public health, because I know you've talked in government, but then to sort of segue that into, you know, your role now and the sorts of things that you can do to kind of help public health students along the way in their as they start to think about their journey in public health.
Thanks, Claire. I I think similar to the other guests, I'm an accidental public health professional. I think I worked in public health for probably 5 years before I realized I worked in public health. So my accent is from America. I've been here 34 years, and I came out for 6 months to have a bit of a play of softball and to do some coaching. And long story short, the coaching became a profession for me. So I was a professional sports coach at the Sports Institute for a while, and that was my passion. And I think probably I'm not going to give the whole journey of my career from there to here. My degree was in human movement, and I sort of went from sport to sport development, the broader rec and sport industry. Then the government launched its physical activity initiative for the obvious health reasons. And, you know, I played in that space for a long time, that was when I was probably an accidental public health person leading the state physical activity strategy and working in that space. But probably the key for me was what everyone has said, that if you find something, they say that if you do what you love, you'll never work a day in your life. And it seems like all the panel members have followed a passion and you know, happen to work in an area that they love. And that is what's happened for me as well. I did work with Lisa in state government and local government on the Opal Initiative and in a number of other roles with non-government organizations at other universities. But this opportunity to combine my coaching background and to support students in the Masters of Public Health as a success coach, a role that's unique to Torrens Uni, was what drew me here. And I think, Claire, part of being on this panel is to explore what Torrens offers its students that are the Masters of Public Health students in terms of not just during their course with us, but then about getting a job in an industry that they're passionate about. So I'll hand it back to you. And
Okay, great.
do you want me to talk more about
yeah, well,
that side?
I'll introduce Peter as well, and then we can have a bit of a chit chat between all of us. So Peter, welcome to the chat. Thanks for sitting so patiently listening to all of us tell our stories. Peter is very new to Torrens University and has got the mandate to connect public health students with industry, I think. So if you can just talk a bit about that, Peter, that'd be great. You're going to put you're muted. You're muted. Yeah.
That was my moment of truth, and I blew it. The Social Enterprise Hub is new, as Claire suggested, but really it exists to support two agendas for the university, one being about our social impact, so our contribution to making the world a better place. And it's also supporting students to create opportunities for them to work with enterprise. So I've been working, you know, closely with Claire and with Amy and Terry, a bit with Mitchell, in identifying ways that we can create opportunities for the public health students to support our social enterprise clients. We map all our social enterprise clients against the UN Sustainable Development Goals. So a lot of those are going to be related one way or another to that public health arena. So we're kind of just at that stage of exploring different ways that we can get public health students to support the enterprises. And that could be through a program evaluation. It could be stakeholder engagement. It could be needs assessment with the local community, getting feedback from consumers and users, mapping all the services that are available to that local community, helping to develop strategy. We had one of the recent students working with palliative care in Queensland and helping do consultation around the palliative care policy for Queensland. So we're always keen to work with students in the academics to see ways that we can create really interesting, challenging opportunities, but often they're a little bit left of central in terms of how they contribute to a student's employability and also helps to develop their skills, apply the skills they've learned through their studies.
Perfect. That's great. Yeah. So look, there's lots going on at Torrens at the moment, and I think all the students will be aware that there's some internship opportunities. There's opportunities to be part of seminars where we have industry come and speak in at Torrens. But I suppose it's a bit of a two-way street. You know, we've got students who need to reach out. We've got the lecturers and success coaches who want to help people. But I suppose what I wanted to ask everyone here was, what's the tips and tricks for throughout your career that you've kind of learned? And I think Tori sort of came up with a couple, but what's the tips and tricks regarding things like networking and internships, and do you think they're useful? And yeah, just any comments on that? Anyone can jump in.
Just as a general comment, I often think that students will think that if I do well in my studies, I'll get a gig, I'll get a job. And the reality is, if you do well in your studies, that may contribute to being more effective in the job market. But potential employers are going to be looking at the other things that you've done, where you can demonstrate that you've applied your learning, your studies to a real world setting.
Yeah, good point.
So, you know, the more experiences that you can build into your CV that demonstrate not only have you got the head knowledge, but you can apply it, and you've actually helped an enterprise, a government agency, deliver an outcome to the benefit of the community, a public health outcome, that's going to help your CV quite significantly.
Yep. Lisa, have you got, oh no, sorry, Rachel was going to say something.
I was just going to say, I agree with that, Peter, and I think, you know, the more you can demonstrate that you had some kind of real world impact in your job, that's definitely a plus. I think also, as we mentioned before, you know, people tend to think of networking as being a very formal networking, like you're going around giving a business card or doing whatever. But I've actually had 2 of my jobs through LinkedIn, just through being contacted in LinkedIn by someone who knew one of my contacts. So I've actually found that I have been recommended for jobs quite frequently by my former bosses and employers. So once you actually get started in that, you know, in those kind of roles, do make sure you always ask for a reference from your current employer if you feel like you've done a particularly good job, and make sure to link in with them on all the networks and things that you can keep available, because I still stay in touch with a number of people I used to work with through the years. And the thing is, as soon as a new opportunity comes up, people always ask, you know, do you know someone who would fit in well with our team and who we can trust to do the work and that kind of thing? And they think, oh yeah, you know, or either I know someone or I know someone who will know someone. So just always remember that, because yeah, I mean, I'm not particularly good at networking. I'm a little bit shy and I'm quite an introvert, but there are forums like LinkedIn and like other places where you can kind of just go on, put your profile up there, and there's a lot of opportunities that kind of find you, I think. So yeah, I'd strongly recommend that.
Awesome, that's a great tip, really good tip. And especially, like you said, if you're a bit of an introvert, don't consider yourself a networker, then there's lots of different avenues. Now, as I talked about before, I have just got the warning from Zoom that it's going to log off. So if you guys don't mind and don't lose your train of thought, we're going to log off for we'll come back for part 2. So I'll just shut this down, and if we all log straight back in, it will be all good. So I'll see you in a minute or so. Sorry about this.